Hi everybody, it's Dr. Magnifico from Vet and Polly.com. This is Presley. He is about a 6-month-old bulldog. He is here to get neutered. So some of the things that we do before a neuter is we make sure the adult teeth are in place, make sure both testicles have distended into the scrotum. We do pre-op blood work here, so it's a partial panel. It's about $50. He's all up to date on his puppy vaccines and he's ready to go. When we talked about his neuter, because he's a bulldog, meaning a brachycephalic breed, so he's got a very short nose, and you can see by his underbite he's got an even shorter nose. We talked to the owners about some special precautions for a neuter. Some of the things that I like to do with the brachycephalics are, I make sure they've got all their stuff, so all of their puppy stuff is done. He's protected against all of the puppy diseases. His blood work is normal. Everything in his physical exam is normal. And then we put an IV catheter in him, so he's got a catheter in. Has been on fluids for the last couple of hours. I just gave him a very mild sedative, and now he's being pre-oxygenated, so I have him just on straight oxygen to get his red blood cells fully perfused with oxygen because they have trouble breathing. So brachycephalic breeds have four things that we worry about. They have stenotic nares, meaning the nose is very closed, everted saccule, so those are in the back of the mouth. They have a hypoplastic trachea or a weakened trachea. And then they've got an elongated soft palate. So all of those things contribute to making it difficult for them to breathe, which is why they sort of snort a lot. So we are taking every precaution with his neuter to make sure that none of those things cause a problem. He's going to be sedated. Induced with propofol, which is a very quick-acting anesthetic. He'll be intubated. We'll maintain his oxygen and we'll monitor him very closely, and then get him off of the table as soon as we can, and then we will make sure that he's awake before we pull his endotracheal tube. So there's quite a few things that you should do for your brachycephalic dog if you are talking about surgery with your veterinarian. Certainly he is not a guy who should have surgery done at a high volume clinic. There's just too many predicating risk factors to be comfortable with that. So talk to your vet about special care for your brachycephalic dog. If they're going under surgery, make sure you understand what they're going to do, what extra precautions they're going to take, and what the costs involved with those are going to be. At my clinic, a neuter is $175. We put a catheter in, that's $40. We run IV fluids, that's another $40. The propofol is $60. And then I don't charge for the oxygen. But his $175 neuter is going to be probably around $250 when all's said and done. But it's the best chance we've got to making this surgery as safe as possible. If you have any questions, you can find me anytime at Vet or Polly.com. If you'll wish little Presley a little luck, he's getting ready to go under and have his neuter done. Take care, everyone. Bye.